Priya sat across me at her regular follow-up visit, and she was rubbing her hand together in her lap the way I had noticed her doing for the last 1 year. This quiet, almost unconscious gesture, like she was warming them up or settling them down. Her labs were on the screen. The DAS-28 measure of rheumatoid arthritis was 1.8, textbook remission. 8 months of controlled disease. Her medications were working exactly the way they were supposed to. She looked at me and asked a question I was not expecting. My numbers are good, my doctor says I'm doing great, but I still feel like a sick person. Is this just what remission is supposed to feel like? I have been asked a version of that question more times than I can count in my clinical encounter. Because remission on paper and living well in real life, those two things are very different things. And nobody had ever told Priya about the gap. She was sleeping 4 hours a night. She had not exercised since her diagnosis of rheumatoid arthritis. She was still smoking, mostly out of habit and partly out of stress. She was eating on the run because she barely had energy to cook her own. And her marriage was under quite a strain that nobody was talking about. Her medication had done its job. It had put out the fire of inflammation, but nobody had helped her rebuild the house. That's what today's video is about. Because after years of practicing rheumatologist, I have come to believe that medication treats the disease and that the NESSCAR system, NESSCAR, that system heals the life around it. And you cannot have one without the other. They are complementary to each other. Before I tell you what happened to Priya and what her life looks like 6 months after we had this conversation, I want to walk you through the 7 pillars of the NESSCAR framework. Because the moment you understand how each one connects to your rheumatoid arthritis, Priya's story will make a lot of sense for you. And it will also make sense in your own RA journey. So you might wonder, what is NESSCAR? So NESSCAR is an acronym, the 7 letters and 7 pillars of lifestyle changes. N for nutrition, E, exercise, S, sleep, another S is stress care, C is checkups and monitoring, A is avoiding inflammation triggers, and R is relationships. Each one of these has direct evidence connecting to rheumatoid arthritis disease activity, fatigue, function, and your quality of life. And none of them come with a prescription. And let me walk you through each one of those 7 pillars. And the nutrition. The research on diet in RA has gotten a lot clearer in the last few years. The short version, an anti-inflammatory diet, and specifically the Mediterranean diet, is the one that has the most consistent evidence behind in rheumatoid arthritis. Multiple clinical trials has shown that Mediterranean diet or any other form of anti-inflammatory diet lowers disease activity scores. It also improves your body composition, help you lose weight, and also improve in your cardiometabolic markers compared to people who do the regular diet. And what does that look like in regular practice? More fish, especially fatty fish, more olive oil, more vegetables and legumes, less red meat, less processed food, and less sugar. This is not a fad diet. It's not a supplement stack, just food patterns that have documented anti-inflammatory effects. This does not replace your medication, but the food you eat every day is what is either fighting inflammation or feeding the inflammation. So that's why the N is your nutrition, where you eat anti-inflammatory diet. Now the next pillar is E is for exercise. I know what some of you are thinking when I talk about exercise. You might think my joints are hurting. Exercise sounds like the last thing I should be doing when I'm having joint pain. But here's what the evidence actually shows. A systematic review that analyzed almost 51 studies of exercise intervention in adults with rheumatoid arthritis found a strong evidence of aerobic exercise, resistance training, and aquatic therapy. Not mixed evidence, a strong evidence supporting use in rheumatoid arthritis. Exercise reduces inflammation markers. It improves joint function. It fights the fatigue that RA causes, because inactivity is actually one of the biggest driver of rheumatoid arthritis fatigue. And it also protects your cardiovascular system, which is critical because RA increases your cardiovascular risk, increasing your risk of heart attacks. The key is appropriate exercise. Not running a marathon the week after a flare, starting with low impact movement such as walking, swimming, and cycling, and building gradually. If you are not sure where to start, physical therapist who works with patients who have inflammatory arthritis is worth one visit. And the reason is movement is medicine, and the research is very clear on this. So the third pillar is sleep. Sleep is when healing happens. RA and sleep have a complicated relationship. Inflammation disrupts your sleep, pain wakes you up at 3 a.m., and here is the part most people don't know. Poor sleep then worsens inflammation. It is a bidirectional cycle, each one feeding the other. What we know now from the research is that sleep disturbance is one of the biggest independent drivers of RA fatigue, separate from your disease activity and separate from your own medications. Improving sleep quality through sleep hygiene, regular sleep-wake cycles, treating pain that wakes you up, limiting screen exposure, and addressing anxiety that keeps you awake directly reduce your fatigue and improves your daily function. This is one area where behavioral approaches have shown most impact than medication adjustment. Treating the sleep, not just the disease, changes the quality of life picture significantly. 5 to 6 hours of fragmented sleep is not good enough for someone with rheumatoid arthritis. It is a clinical problem worth addressing with your rheumatologist and your primary care doctor. This helps you understand what is the true problem. Now, the pillar number 4, stress care. Here's what happens when you are chronically stressed and you have rheumatoid arthritis. Your hypothalamic pituitary adrenal axis, the part of the brain that manages the stress response, is already dysregulated in autoimmune diseases. Chronic psychological stress adds more pressure to this system that is already under strain. And the data on mental health in RA is striking. Depression is roughly 2 times more common in people with rheumatoid arthritis than in general population. And anxiety is similarly elevated. And the relationship is bidirectional. Inflammation drives mood disorders, and mood disorders worsen inflammation markers. The treatment guidelines suggest, and it explicitly tells, that psychological interventions for fatigue, low mood, and social well-being is the part of the management of rheumatoid arthritis. It is a complementary to the medical treatment. And this is not an alternative medicine. It is the mainstream rheumatology practice. Stress care does not mean meditating perfectly for an hour a day. It means identifying your biggest chronic stressor and making one honest change so that you can handle those stressful situations. Now, all of you rheumatoids over here, I know I'm telling you a lot about these lifestyle changes. That's why I have broken this video into 2 parts. So today we talk about the 4 important components of the NESSCAR framework that includes N is for nutrition, E is for exercise, S for sleep, and other S for stress care. So hopefully you have remembered those 4 things, and hopefully you have added 1 thing today. And in the next video, we'll be talking more about the other pillars of this NESSCAR framework. Before I leave, please subscribe to our channel so that you can get similar type of content, and also ring the bell so that you get alert for these type of videos which we are posting every week. And also put some comment on what are the lifestyle changes you are doing and what is the struggle you are having in your lifestyle changes so that I can support you better. And I'll see you in the next video. Bye-bye.